strange medical mysteries, strange conditions, interesting medical phenomena. Our first story is about a woman named Gloria Ramirez, who was living in Riverside, California. Gloria was a 31-year-old who had 2 children, and she was a housewife. But sadly, at some point, Gloria had been diagnosed with cervical cancer. And on February 19th, 1994, Gloria was feeling really sick. She was experiencing symptoms of nausea, difficulty breathing, and an increased heart rate. It has been reported that she ended up fainting and then was taken to the Riverside General Hospital emergency room via ambulance. And after doing some tests, they figured out that Gloria's heart was beating way too fast for her body. So doctors immediately tried to use a defibrillator in order to send an electric pulse to her heart and restore her normal heart rate. However, while nurses are doing this, they discovered that Gloria's body was covered in a, quote, oily sheen. And they also claimed that her breath was letting off a very interesting smell. They said it was fruity and garlicky. So I'm trying to picture what that would be like. And then this nurse named Susan Kane tried to draw blood from Gloria, but when she started doing this, she noticed that her blood had a really strange smell. It smelled like ammonia. And then doctors noticed that there were these strange beige, pinkish colored particles floating in her blood. And then Nurse Kane started reporting that her own face was burning really bad. And not long after, she ended up fainting and had to be rushed away. But Nurse Kane wasn't the only one who experienced weird symptoms. Several other staff members started experiencing fainting, shaking, and irregular breathing. Other staff members at the hospital claimed that they randomly started feeling sick too. And the hospital decided to declare an emergency. And all the patients in the hospital had to be evacuated and taken out to the parking lot. Meanwhile, Gloria is still not doing well, and nurses and doctors continue to try and treat her. However, they didn't have success, and unfortunately, Gloria did pass away at 8:50 p.m. And after this, 2 staff members took Gloria's body and moved it to isolation. She experienced something known as avascular necrosis, which is actually where bone tissue doesn't receive enough blood and therefore starts to die. I mean, imagine like being in the hospital after treating a patient.
It's clearly something they didn't expect to happen. Something about the blood was toxic.
And then one of the nurses who moved Gloria's body, Sally Balderas, experienced irregular breathing. She also felt the same burning sensation that Nurse Kane did, and she started throwing up. And she ended up having to be hospitalized for 10 days. There were a total of 5 hospital staff that had to be hospitalized overnight. And when all was said and done, Gloria's body ended up affecting 23 staff members from the hospital. Isn't that insane? So going back to that night, around 11 p.m., a hazardous materials team went to the hospital in full hazmat suits in order to try to figure out what was going on here. They searched the hospital for toxic chemicals that could be causing people to get sick, but they weren't able to find anything. So the coroner's office did an autopsy on Gloria 6 days later, and they ended up building a specially sealed room, and the staff had to be in hazard suits in order to keep everyone safe. If Gloria's body really did have toxins in it, they wanted to make sure that these toxins didn't leak. They even took air samples from her body bag to try to figure out what happened and why so many people who came in contact with her got so sick. After the autopsy, people were hosed down with decontaminants. And in the end, they determined that her official cause of death was cardiac dysrhythmia, an abnormal heartbeat caused by kidney failure from her cervical cancer. However, they never got any answers as to what was causing all of the strange smells, her oily skin, the kind of garlic breath that she was experiencing, strange particles in her blood, and of course, why multiple people who came in contact with her got sick. It was reported that there were no poisons, toxins, nothing in Gloria's system that would point to any answers. Medical detectives from 10 different federal and state forensic departments decided to take a look at the case, but no one could ever come up with an answer.
I don't know. I kind of tend to think that this was some type of accidental poisoning, honestly.
Maybe, but with what? I mean, wouldn't it have come up on tests and everything? It would be so hard as a family to just accept that you have no answers and just be wondering about this mystery for years on end.
But this next medical mystery is pretty interesting.
It is. This one took place back in 2008 in Melbourne, Australia, to a woman named Natalie Adler. Natalie says that when she was 17 years old, she had a staph and sinus infection. And one night before a school exam, Natalie's eyes completely shut and she wasn't able to open them back up for 3 days. Since then, this has become a reoccurring event for her. Her eyes will shut for 3 days and then open for 3 days. And this has now been happening for 15 years, people. She says she basically can't see anything except for having a little bit of sight out of the slit of her left eye. Natalie has said, quote, "The night before it sets in, my eyes get quite heavy, and that's how I know it's coming on. And when my eyes are shut, I have a pain on either side of my temples. I feel nausea, my body aches all over. I have neck pain from leaning back trying to see out of the bottom of my left eye." Doctors have never been able to figure out what the cause of this is, and it's so rare that it doesn't even have a name. Natalie has gone through many procedures and treatments and has reportedly had 99% of her muscles taken out of her eyelids. And she still gets Botox in her eyes regularly to try to keep her eyes partly open, but she still experiences complete blindness at least once a month. That's so brutal. I just can't even imagine what that would be like.
I wonder what the root cause is. I wonder if it's like something neurological that's causing her eyes to shut.
And there's not even really any solid theories for this one.
Let's talk about a guy named Brad Williams. This guy apparently never forgets anything. So Brad is from La Crosse, Wisconsin. Brad has an insanely good memory and was diagnosed with something called hyperthymesia. Hyperthymesia is defined as, quote, "the uncommon ability that allows a person to spontaneously recall with great accuracy and detail a vast number of personal events or experiences and their associated dates. Highly superior autobiographical memory." Brad claims that as long as he can remember, he's had this ability.
I was actually thinking about this the other night. I was just rocking our baby and thinking like, I really want to remember this moment, and realizing that I probably won't. The majority of the moments throughout our days, the majority of our days, we don't have any memory of as the years go by. It's kind of crazy to think about how little you actually do remember of your life.
Maybe there's a thing to do with short-term versus long-term memory. Because if you think about it, I know for me personally, I have plenty of mundane memories because like I can remember meals that I had as a kid. Nothing was prolific about those meals, but I have a very vivid memory of going to the grocery store and getting a rotisserie chicken and taking it home and eating it. But do you think that maybe in a few years from now, that 2 days ago lunch is going to be a memory that you're able to retrieve?
No. Well, I can't imagine being able to remember everything.
But
I mean, this guy remembers everything. And yeah, he sees it as an ability. So I think he likes it. This last one we wanted to talk about today is called human werewolf syndrome. So hypertrichosis, also known as werewolf syndrome, is a condition characterized by excessive hair growth anywhere on a person's body. It can occur at birth or later in life, and the excess hair can grow anywhere on the body, sometimes even just in patches.
Hypertrichosis, regardless of type, is very rare. Congenital hypertrichosis lanuginosa, the kind that starts at birth and gets worse over the week, is extremely rare. Only about 50 cases of this kind have ever been documented. Hirsutism, which is limited to women, is more common, affecting about 7% of the female population in the United States. There is no cure to this condition, and treatments are often shaving, waxing, and laser hair removal, which obviously none of these are a permanent solution. But I mean, if you look at evolution, we all were covered in hair at one point. I wonder if it's something that has to do with our genetic makeup and evolution. I wonder if it's like a genetic mutation or something that causes that.
So that is going to be it for our medical mysteries today.
But yeah, I'm especially interested to hear what people think of Gloria's case, because
it's a real
that one's
mystery.
truly baffling. Keep taking your mind
A mile.